In the quietest corners of Pakistan's poorest communities, a heartbeat isn't a guarantee, it is an expense. While you watch this, a mother's life is being battered against numbers she can never hope to pay. Pakistan's public health infrastructure leaves families stranded, allocating under 1% of its entire GDP to healthcare. The public system is broken, forcing the private sector to carry over 70% of the country's entire disease burden. For the poorest of the poor, there is no safety net. Over 60% of every medical expense must be paid directly out of their own empty pockets. When structural deficits leaves only one doctor available for every 10,000 citizens, poverty becomes a terminal diagnosis. This is a healthcare crisis hiding in plain sight, paid for in human blood. Every single year, nearly 12,000 vibrant, irreplaceable women vanish from their families, victims of a national maternal mortality ratio of 186 deaths per 100,000 live births. It is a biological tragedy born of neglect. 42% of these pregnant women are forced to fight through their pregnancies with severe life-draining anemia, leaving them starved of iron and defenseless against fatal postpartum hemorrhages. And their babies, they never stand a chance. 50 out of every 1,000 infants die in agony. 35 per 1,000 perish in their very first month of life, alongside an unconscionable tide of stillbirths. Trapped by isolation and poverty, less than 45% of these mothers ever see a trained professional during childbirth. Desperation drives millions to unsafe, clandestine, and lethal interventions just to survive. They're not just statistics. They're mothers, daughters, and wives dying in the dark. They die because of 3 unforgiving, systematic bottlenecks. The 3 delays that steal human lives. Driven by the paralyzing fear of costs they cannot afford, trapped by broken infrastructure and absolute geographic isolation, arriving at broken clinics that lack trained hands and basic medicine. Greenstar Social Marketing's health ecosystem exists to shatter this lethal chain, bringing quality, dignity, and life directly to their doorsteps. But look closer. This is where the dying stops. Greenstar is rewriting the future of healthcare through a sustainable network of 23,000 Sabz Sitara providers and specialized sanctuaries like the Greenstar General Hospital. We don't just offer a room, we offer absolute clinical excellence through continuous medical education and unyielding quality assurance. We actively dismantle the financial barrier by completely subsidizing care for up to 40% of the most vulnerable mothers. We bridge the gap between life and death. We guarantee that when a mother walks through our doors, she is met with trained hands, life-saving medicine, and the right to survive. For just $175, you can personally guarantee that a mother will not die from the crime of poverty. Your single donation intercepts her fate. It funds an unbreakable continuum of care that shields her and her child from the statistics of death. $175 to buy a mother her life. Donate today, because no woman should ever have a price tag on her pulse.